Question number 6, the Honourable Ruth Dyson.
Thank you, Mr Speaker. My question is to Minister of Health. What guarantees can he give of continued access to primary health care?
Mr Speaker. Honourable Jonathan Coleman, on behalf of the Minister.
On behalf of the Minister of Health. The guarantee this government will give is that it will be working hard to improve access to primary care, despite inheriting a major shortage of health professionals, including GPs, in many parts of the country. That is why the government has announced the voluntary bonding scheme, which already has 115 doctors registering an interest, and has announced 50 extra GP training places over the next 2 years and 60 extra medical training places next year, as the first tranche towards an extra 220 extra medical student training places. We are also conducting a line-by-line review so we can move money into frontline services.
Honourable Ruth Dyson.
What response has he to the concerns expressed by Dr Gay Keating, who says the government has focused on the wrong area and more money should be spent on primary health to keep people out of hospital?
Honourable
Mr. Speaker.
Coleman.
Well, Mr. Speaker, there is always going to be a variety of approaches and views on where the money should be spent, but I would note that this government has committed $750 million in the last budget as new spending in healthcare, and I think they'll find that's actually going to produce greater outcomes, better results for New Zealand patients.
Michael Woodhouse.
What reports has the Minister seen in relation to health funding, including primary health funding recently?
The Honourable Jonathan Coleman.
On behalf of the Minister of Health. I have seen reports that show that last year Labor planned to cut over $110 million allocated to projects across the sector. Whoa. This included cutting $13 million for primary health care, $10 million for people with disabling chronic medical conditions, and $24 million for public health services. Strange actions indeed for a party that pretends to be horrified by line-by-line reviews.
The Honourable David Cunliffe.
Mr Speaker, as the Minister, yes, it is a point of order. Mr Speaker, the Minister opposite has quoted a number of figures about purported, quote, cuts to public health. He's not made clear, sir, whether they were reprioritisations.
The member can't do this. No, order. The member cannot litigate an answer by way of point of order. Further questions can be asked if the members don't think that the Minister has given accurate information. They can drill into that with further supplementary questions, but can't do it by way of points of order. The Honourable Ruth Dyson.
Why did he refuse to give the Health Select Committee any assurance that this year's increase in GPs' fees of 6.5% will not be repeated in the future?
The Honourable Jonathan Coleman.
Mr Speaker, there is a well-established framework set up under the last government for changes in doctors' fees, and this government's adhering to it.
The Honourable Ruth Dyson.
What link does he think there should be between the rate of inflation and the increase in GPs' fees, or are his actions just confirming his view that the GPs and the market should set the fees?
The Honourable Jonathan Coleman.
Well, Mr Speaker, it's tight financial times. GPs are having difficulties maintaining financial viability just as anyone else is. They're trying to provide a service, and I'm sure they will continue to do in very straitened financial circumstances.